At Children's Health Queensland, we're committed to achieving health equity for Aboriginal and Torres Strait Islander children and young people. Health equity means everyone has the chance and the right to be as healthy as possible, according to their unique needs and circumstances.
Sometimes, experiences of racism or an inability to access healthcare can prevent this. Sometimes, the way care is delivered impacts this too. The impacts of colonisation have had detrimental effects on the Aboriginal and Torres Strait Islander culture. Systems in Australia were often built at the exclusion of Aboriginal and Torres Strait Islander peoples. Unfortunately, that means that in some places where care is provided, there still exists a lack of cultural understanding, racism, and services that don't meet the needs of Aboriginal and Torres Strait Islander communities. At Children's Health Queensland, we acknowledge this and we are working hard to improve our services.
Across Queensland, about 97,000 children and young people identify as Aboriginal and or Torres Strait Islander. That's around 7% of the state's population. By the end of 2023, this is expected to grow to more than 124,000 people. Despite some areas of improvement over the past 15 years, Aboriginal and Torres Strait Islander children still do not enjoy the same health outcomes as other Australians. The early years of a child's life are really important for setting them on the right track for a healthy future. We know that many of the conditions that can show up for adults are entirely preventable if kids can get a good, healthy start to life. We can support this by making sure they get the right culturally safe care and by giving them the tools to make deadly choices about food, physical activity, and mental health.
Children's Health Queensland's Health Equity Strategy is a roadmap for how our services can be improved to ensure that Aboriginal and Torres Strait Islander children and their families can access the care they need and want to receive in their way. We will do this by partnering with community, organisations and with other government departments to create better ways to provide healthcare to Aboriginal and Torres Strait Islander children and young people. To create our health equity strategy, we listened to more than 250 Aboriginal and Torres Strait Islander people from right across Queensland, and we heard what matters to the community's children, young people and families. The voices of the community can be heard throughout the pages of our health equity strategy as they shape the themes and inform the ideas that we will prioritise over the next 3 years.
These include eliminating racism in all its forms, increasing access to care, influencing the social determinants of health, delivering culturally safe care, creating shared ownership of health services, and strengthening our Aboriginal and Torres Strait Islander workforce.
There is a long way to go to close the gap in health outcomes for Aboriginal and Torres Strait Islander children, but we are committed to accelerating efforts to achieving real and sustainable change. We are committed to our important role in preserving the oldest surviving culture in the world by improving the health care that we provide to its children and young people here in Queensland. We have heard what the Aboriginal and Torres Strait Islander community has said, and we will listen, learn, and work together on this journey.